Hey everybody, it's Governor Andy Beshear. I hope you're having a good but also a very safe weekend. Just want to quickly say we're going to get through this. We're going to get through this together and give you a quick update on COVID-19 so that you can get back again to that safe weekend being healthy at home. Today, we've got a higher number of cases, but thankfully we are continuing to see a lower number of deaths. So today we're reporting 244 new cases of COVID-19. Many of those are from the Jefferson County area. There's been both an outbreak at a facility called Maryhurst, one that my wife and I care very much about, and I know they're doing a good job to address, and also at JBS, the meatpacking facility that is there. Those results, the 244 positives, we're out of now a total number of tests that we've done in Kentucky of 129,405. That's with most labs not reporting on Saturdays. Number of patients ever hospitalized, 1,967. Currently hospitalized, 438. Ever in the ICU, 866. Currently, 270. So that's up. We got to be thinking about those folks. We got to watch that number, but know that 270 Kentuckians are in intensive care right now. Let's make sure that we are supporting their families. And the total number of recovered, 2,768. When we look at these new cases by counties, 94 of them are in Jefferson County, 30 in Boone, 25 in Warren, 19 in Fayette, again, a lot of that driven by the federal prison, 10 in Shelby, 7 in Kenton and Logan, 5 in Butler, Ohio, Oldham and Pike, 4 in Russell, 3 in Callaway, 2 in Campbell, Franklin, Hardin, Henderson, Meade, Pulaski, and Simpson, and then 1 in Allen, Bullitt, Edmondson, Knox, Leslie, Madison, McGoffin, McCracken, McLean, Muhlenberg, and Washington. When we look at deaths today, thankfully we are seeing lower numbers. We're actually seeing lower overall hospitalization, even with that ICU number up. We did lose 2 Kentuckians that we're reporting today to COVID-19. The first is a 90-year-old from Muhlenberg County, and the second is a 74-year-old male from Jefferson County. Now, let's make sure we light our houses up green tonight, our places of business, everything out there. Again, 2 families, 2 communities that need our help and need our support. That brings our total number of deaths to 334. And while that is so much lower than any model, which is based on your incredible work, which has saved tens of thousands of lives, none of us want to lose 334 Kentuckians, so let's continue to do what it takes to protect one another. Our total number of cases as it stands to date, 7,688. When we look at the breakdown of race and ethnicity, where we are today is overall cases, 73.9% white, 14.77% black or African American, right about 6% Asian, 5.22% multiracial, and then it's about 86.5% non-Hispanic and 13.5% Hispanic on ethnicity. On deaths, 77.59% white, 19% black or African American, 2% Asian, 1.3% multiracial, and it's really right at 98% non-Hispanic and 2% Hispanic for ethnicity. Now we are continuing to increase our testing in long-term care facilities. So we report 13 new residents, 13 new staff have tested positive, and overall 5 new deaths. Remember, those go back into previous reports and until we're able to ascertain that they were in long-term care. So today, cases up, and we'll watch that even though there's more testing. But again, deaths overall, hospitalizations seem to generally be down. The importance here is that if we want to reopen this economy, we want to do it safely. We got to remember that there's still a virus out there. It spreads aggressively to certain populations. It can be deadly. So be healthy at home. Be healthy at work. Make sure we follow these rules and restrictions. Let's pass this test of humanity. Look out for one another. Remember, people are going through a lot of time and have a lot of anxiety. Be kind to one another. Be a good neighbor. And I will see you Monday at 5 p.m. Thank you.